Hello, I'm Dr. Alvarez with Endobariatric.com and welcome to another video of our FAQ section. Today we will be talking about feeling a lump or a hardening sensation under your incisions. Now, it's very important for you to understand that having weight loss surgery nowadays is done through laparoscopic surgery, also known as minimally invasive surgery, also known as keyhole surgery. And this procedure, what we do is do a tiny incision on the skin, and then we use a special instrument to poke through the abdominal wall layers. And when we finish, we close the bigger incisions. Well, we close all the incisions on the skin, but underneath them, the bigger incisions are closed with a special suture. And as the days go by, right after surgery, it is very normal, and this applies pretty much to any type of laparoscopic surgery. It will become, it'll harden, it'll become hard. If you feel very carefully, you may feel like a little golf ball, like a little ball, that sensation of feeling a ball that's very hard right underneath each one of the incisions, although it is more easily to detect under the bigger incisions. In gastric sleeve surgery, it will be probably the middle incision, and of course the incision where we pull that big chunk of stomach out. That big portion of stomach that we remove comes through the biggest left side incision. And patients, is very common, patients all of a sudden the swollen tissue starts to come down and they're laying in their bed and they're just feeling, and then I got a lump, I got a hardening sensation, I got a big ball here, what's going on? And it is very common for patients to email us. It's like, what's that? That sensation, that is normal, and it goes away in the next 6 to 8 weeks. It's part of the healing process. That hardening sensation, I like to tell patients it's part of the healing process. It's like human cement, where everything is healing, and then as the weeks go by, it becomes soft again. Now, this is very, very common to feel right after surgery, the first 6 to 8 weeks. Normally the first few days right after surgery, probably 5 to 7 days, because that's when the swollen tissue starts to come down, the puffiness of the surgery starts to come down, and you start feeling your tissues the way they are, and then you feel that little ball there. So it's like, what's going on? So just to let you know, that is completely normal. Again, you'll feel this with any type of laparoscopic surgery. Patients who get their gallbladder removed will have the same sensations, the same feeling, will have this happen to them, or their appendix, or their have a hysterectomy, etc. But of course, with gastric sleeve surgery, since it's done laparoscopically, will also apply. So put your mind at ease. This is normal. It'll go away. Give it 6 to 8 weeks. Now, if this is something you feel months or years down the road, that you feel a lump under one single incision, because right after surgery, if you feel carefully, you'll feel them on all the incisions, but it's more perceptible on the bigger incisions. But now, years down the road, you feel one lump under one incision that whenever you strain, you do this effort on your core, it bulges out. That is not normal. That's probably a hernia, and a hernia needs to be diagnosed by your doctor. Touch base with your local doctor, and we'll probably have an ultrasound done, or just by palpation we can actually diagnose the hernia. So if it's just one single incision, years down the road, touch base with your doctor. Otherwise, give it some time, 6 to 8 weeks. It'll go away, patience. And of course, if you have any questions, you could always, well, my patients have my direct email. They can always email me or touch base with your surgeon. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.